Coming up on Medwatch today, a young woman's life turned upside down. What she thought were seizures was really a rare genetic mutation affecting her heart. Breaking the stigma from hepatitis C, why more people are now being tested, and the advancement of treatment that's saving lives. And we take a closer look at a nationwide effort to stop the bleed, the training available through community medical centers, and why it's considered life-saving advice that anyone can do. Hi there, and thanks for joining us. I'm Julie Musgrave. A Clovis teenager had her world turned upside down last year when what appeared to be seizures really turned out to be a life-threatening heart condition. But thanks to her pediatric specialist at Community Regional Medical Center, she's staying ahead of what could have taken her life.
2 years ago, she was a normal, regular girl that was having fun. And she was carrying this with her, and she didn't know.
15-year-old Taryn Anderson used to do it all. Horseback riding, gymnastics, cheerleading.
Those activities kind of just faded away.
Last year, Taryn had what she thought were seizures.
So I had lost color, I lost my pulse.
Dr. Anna Cole is the chief of pediatric cardiology at UCSF Fresno on the Community Regional Campus. Taryn came to her for evaluation, just a routine procedure.
I took the EKG, looked at the detail, did it myself, and she had a QTC about 500 milliseconds.
Dr. Cole says normal is around 450. Taryn's dad, Don, knew it wasn't good.
You could see that recognition in her face, like, I think I see something here. What is this?
When I look at her EKG, then I realized that this was probably not seizures, that this is long QT, which one of the presentation can be seizure-like presentation.
Long QT syndrome is a rare heart rhythm condition that can cause fast, chaotic heartbeats from an imbalance of the body's salts and minerals through the heart's cell channels.
They either allowed too much to come in, or they don't allow the electrolyte to get out of the cell.
There are no symptoms other than sudden cardiac events. The typical warning sign is death.
She was lucky enough to have an event that wasn't bad enough.
Fewer than 1 in 4,000 kids have it. In Taryn's case, the cause is genetic.
This was a lot to take in for my whole family. And I was just like, nothing's wrong with me, so I was just kind of confused, I guess.
This is the moment we're going to fix this. Whatever that means, we're going to get it fixed because we can't play the odds game going forward.
The Andersons say they hope Taryn's case can bring awareness to the value of genetic screening.
I didn't know about it until my child was affected with it. So I think from an education standpoint, there's a lot that we can do to help people identify with, whether or not they or their children have it.
Taryn now takes a daily medication. She also has a defibrillator. And while life isn't exactly the same anymore,
it's shocking. Like, none of my friends are going through this.
Taryn is taking it in stride, living every day, feeling lucky to be alive.
If I didn't have the doctors that I have today, I definitely would not be alive. No doubt.
Dr. Cole says if parents have any concern for their own child's heart health, especially student athletes, they should request to have an EKG done. If you have any questions about seeing a pediatric specialist at Community, call 559-459-4KID. Hepatitis C is a viral infection of the liver. Just a few years ago, there were treatment options, but even then, it was just a 50% cure rate. Things are different now for the better. Dr. Marina Reutman with UCSF Fresno has more on these treatment options and how it's helping remove the stigma associated with hepatitis C.
Hepatitis C can be a silent infection, and most often it is a silent infection. It can be present in the body of a patient for decades and have no symptoms whatsoever until the patients develop cirrhosis. So the goal is to be able to diagnose hepatitis C earlier on in the course of the disease before it has developed complications. So what happened in 2013 is a new drug came to the market, and this drug was not only extremely effective, greater than 90% of patients, on average would be cured. It was also remarkably well tolerated. Oftentimes patients come to me and ask me, Doc, are you sure you're giving me the right medication? I feel like I'm taking a vitamin. So this has been really a revolution in being able to treat hepatitis C. So many people don't know this, but the largest population at risk for having hepatitis C is the baby boomer population. The baby boomer population is defined as those born between 1945 and 1965. And those patients have a risk of chronic hepatitis C that is 3 to 5 times higher than the general population. Why the baby boomers? I think there's a lot of speculation for why, there's a higher risk for baby boomers. It may have to do, with the Vietnam War, with the drug experimentation, with the sexual revolution. So there's a lot of potential factors that play a role into it. But the beauty behind the CDC recommendation is that we don't have to go into the detail of what type of risk factors an individual patient has. You just simply are at a higher risk and you need to be tested. So therefore, the CDC, the Centers for Disease Control, came out with a recommendation that all baby boomers, irregardless of their risk factors, need to have a one-time testing for hepatitis C. I really want to make sure that the patients know that hepatitis C is by no means, a death sentence. It is very treatable and, most importantly, very curable.
Coming up on Medwatch today, new studies show the latest group being affected by opioid overdoses is children. What you need to know. Plus, a boss that brings in puppies and lets you dunk him underwater. How our healthcare hero is helping ease the stress in a stressful department at Community Regional Medical Center. Did you know 6 out of 10 trauma surgeons at Community Regional Medical Center are women? With an average of only 19% female surgeons nationwide, we applaud these women and all women in the healthcare field for their achievements and for making a difference in our communities in honor of National Women's History Month.